Hi, my name is Shanielle Baird, and I am a nurse practitioner over here at Eastern Idaho Regional Medical Center. This presentation is geared toward patients that are having total joints and spinal fusions. One thing that you will notice throughout this presentation is we're going to mention moving early, and that's just going to help promote a faster and safer recovery for you. We do like to put the caveat in that if your surgeon gives you specific instructions, follow those instructions if they're different from what we tell you, just because we work with a lot of surgeons. So a lot of times we give, generic instructions for certain things, but if your surgeon tells you something specific, please follow those instructions. These are just what we're going to talk about today. Preparing for surgery, your hospital stay, how to reduce complications. We'll talk a little bit about physical therapy, pain management, and discharge. Here is the EIRMC mission statement. Above all else, we are committed to the care and improvement of human life. Our care is customized. We treat you as an individual. We don't just lump you in with everyone that's having a total hip is put in this category. We know that you have individual needs, and so we look at that individually. We want you to be a part of the decision making. So be your advocate. If you're getting a medication and you're not sure what it's for, say, why am I getting this medication? What are the side effects? We love when you ask questions and are an active part of your care. But be clear and honest with the information you tell us. We do need to know, things. If you have a history of substance use, please let us know that. We're not going to judge you, but we do want to make sure that we are giving you good care. We need to know all information to do that. These are some of the people that are going to be taking care of you during your stay. One person I do like to highlight is the leadership grounding. Usually a leader does like to visit you before you are discharged. We like to find out what you liked, what you didn't like, anything in between. We can't fix anything if we don't know there's something wrong. At the same time, if there's something you really like, let us know that so we can keep doing that. Some of our amenities here include chaplain services, pet therapy, comfortable waiting areas, cafeteria. If your loved one wants to go get something to eat while you're in surgery, they are more than welcome to do that. We have City Bagel, coffee shop. There's a couple different options for them. Chaplain services. I have had a few patients ask for chaplain to pray with them before their surgery. They're happy to do that. If you just let someone know, we can help get that arranged. Our waiting areas have recently been remodeled, so there is a TV in there that does give updates on your loved one. I think you get a code and then it'll say, in surgery and recovery. So we try to keep you updated the best that we can. EIRMC is a tobacco-free campus. We do like you to stop using tobacco products at least 6 weeks prior to surgery, just because it can increase surgical complications, decreased wound healing, things like that. At minimum, we say 24 hours to stop tobacco products. And that also includes, vaping, chew, cigarettes. So minimum of 24 hours, but ideally 6 weeks. Visitor policy, it is 6 a.m. to 8 p.m. This does change during flu season, pandemics. We saw that with COVID. Visiting changed quite a bit, and other potential circumstances could change visiting hours, but in general, they're from 6 a.m. to 8 p.m. If your check-in time is at 5:30 a.m., you're welcome to have a person with you in the pre-op area. So even though visiting doesn't start till 6 a.m., you can have your spouse or your parent or friend with you to check in for your surgery at 5:30. Main entrance is closed 8 p.m. to 5:30 a.m. If you are supposed to check in earlier than that, you may need to go through the ER and just tell them that you're there for surgery and they can get you admitted that way. If you have a guest that is not feeling well, we do encourage them to stay home. We don't want to bring in more illness than we need to. And then no photography or video in our facility without prior approval. Okay, preparing for surgery. So being prepared increases your success and your comfort during the surgical process and recovery. We want to see you have a good recovery. We want to see you be successful and get back to having an active lifestyle and the quality of life you want. Home preparations. So consider having help at home, I say for at least 48 hours after surgery. You just had a big surgery, you might be on new medications, you've had anesthesia, so at least 48 hours. But if you have help at home for a couple of weeks, awesome. Preparing your home for a safe return. A lot of people will go home using a walker. I would just, walk around your home. Think about, okay, will this get caught on a loose rug? Will I trip over this cord? But just walk around and see, is your walkway big enough to accommodate a walker and someone assisting you potentially? Go into the bathroom, look, am I going to be able to get up and down from the toilet? Just look at things like that. Try and clear your walkways and just make it a little easier for yourself when you get home. Consider having pet care. We all love our pets. They're amazing, but a lot of times they like to run in front of you. We really don't want you falling. We really want to make sure that you allow your surgery, your incision, everything to heal properly. And finding pet care for a week or two might make that a little bit better for you. If needed, you can obtain a temporary handicap parking pad. You just go to the DMV website, you can print it off, fill it out, have your surgeon sign it, and then send it back to the DMV. I do believe it's good for 3 months, unless that's changed recently, but it's very helpful. That way it helps you get out and moving, but you're not doing excessive walking and things like that. Pre-admission testing. So with these surgeries, we do like you to come in for a pre-op appointment. During this appointment, we're going to get a lot of stuff ready for your surgery. We're going to do medical verification. So we want to know your medical history. We want to know if you have drug allergies, what medications you're taking, that kind of thing. We're going to have you see a nurse practitioner that are going to listen to your heart and lungs, and then they're going to help get paperwork together. If the surgeon needs anything, they can help with that, as well as anesthesia. We love this place. We call it a one-stop shop because we can do blood work, we can do your EKG, so you're not having to go to 3 different departments. Basically, you come see us, we do your lab, your EKG, you see the nurse practitioner, we give you all of your instructions just in that one spot, and you don't have to go multiple areas. We will give you instructions or an education about stop surgical site infections as well as enhanced surgical recovery. Both of those are programs that we participate in to help promote a good recovery. For example, with the stop surgical site infections, we are going to have you do a special shower the night before surgery and the morning of surgery to help reduce risk of infection. And so we'll talk to you about that when you come in. We will go over all your pre-op instructions. We'll tell you what time to check in. We'll tell you what medications you should take. We will answer all your questions as well. So, and if you have any questions, our phone number is listed on that paperwork multiple times. So please feel free to give us a call anytime prior to surgery if you have any questions. We are happy to talk with you. What to bring when you come to this appointment. Bring your medication list, bring your medical history. So if you have recent surgeries, hospitalization, testing, let us know that. If you had lab work done 2 days beforehand, we might be able to use that depending on when your surgery is and depending on when the lab work was done. A lot of times we do try to call ahead of time and get this information over the phone. And that's okay, we'll put that in the computer. But if you have a change in your medications from the time we talk to you to the time you come in, let us know. It's easy to update, and we'll get that updated for you. If you bring your insurance card and identification, we can get that scanned in, and it saves you a little bit of time on the day of your surgery, one less thing to worry about. Infection prevention. So if you become sick in the 5 days prior to surgery, let your surgeon know. Your body's already going through a lot of things when you have surgery. So, it might be worth postponing that surgery for a week or two and make sure you're at your optimal health. Make sure your body's not going to be extra stressed when you do have surgery. And, it also helps reduce risk of infections as well. For dental work, take care of dental problems right away, and then let your dentist know you have a total joint or you have hardware in your back. A lot of times, depending on the surgeon, depending on the procedure, or sorry, the dentist and the procedure, they may want to give you an antibiotic prior to certain procedures. So just let your dentist know that you have a total joint or you have a spinal fusion. What to pack for a hospital stay. So if you have glasses, dentures, hearing aids, we're totally fine if you bring them. Just if you could bring a case with them, that would be great. It just decreases the risk of them getting broken or lost. So just bring a case with you. Loose fitting clothing. Just think about what's going to be easy to get on and off after surgery. So, if you're having a neck fusion, you may not want something that you have to pull over your neck, a button that might be a little easier. Total knee, jeans might be a little bit rough. You're going to have a little bit of swelling, but sweatpants, basketball shorts for women, sundress, any of those might be a little bit easier for you. For shoes, just make sure they're comfortable and they're sturdy for walking. We don't want you to slip. So, having a little tread on there is okay. At the same time, excessive tread you can get your foot caught a little bit. And so just something that's comfortable and sturdy. Photo ID and insurance. If you didn't bring it to your pre-op appointment, just bring it day of surgery. That's okay. We'll get that scanned in for you. Personal hygiene items. We do have things here if you forget them, but a lot of people like to bring their toothpaste from home, their shampoo if you're staying overnight, and that's completely fine. Entertainment items to occupy your time. So less boredom equals less pain. When you have something to do, you're not sitting there focusing on the pain from your surgery. Okay. And we have a slide about the entertainment items a little bit later, but it can be as simple as book or having people visit you or, your tablet if you want. Totally up to you. Bring something that you enjoy doing though. Cell phones, you can bring those. I would just bring a long cord to go with them. And then your patient education book, we do give you a copy when you come to your pre-op appointment. And that book has a lot of this information in it. It talks about really how to prepare for surgery, how to prevent post-op complications, physical therapy exercises. A lot of people find that section very helpful. Okay, what not to pack. So CPAP and BiPAP. So if you have sleep apnea, don't bring your CPAP or BiPAP machines. We do have them here. I do believe it's helpful if you know the settings of them. But for infection prevention reasons, we do ask you leave your CPAPs and BiPAPs at home. Don't bring any valuables with you. We do not want anything going missing or getting broken. So best thing is prevention. If you don't need it, just leave it at home. Okay. Medications, we will provide your medications while you are here. There are some exceptions where a staff member will talk to you about bringing your own medication from home, but in general, we do provide all your medications during your stay. Transportation, you will not be able to drive yourself home from the hospital. Okay. Plan on needing help with driving transportation for 2 to 4 weeks following surgery. It depends on the type of surgery, how well you're recovering, what medications you're on. If you are taking narcotic pain medications, you can technically get a DUI if pulled over, okay? So just easier to have someone help you for a couple of weeks if possible. Surgery day, so what to expect here. So follow any instructions given during your pre-op appointment. So we'll give you very, very specific instructions about showering. We'll tell you which morning medications to take. We'll write them down for you so you can look at that list and not say, oh, I can't remember if they told me this or this. We will write it down for you, and so you'll have a list you can definitely look at. And then with some surgeries, we will have you drink what we call the ESR beverage. So enhanced surgical recovery is what the ESR stands for. And basically that drink just has extra carbohydrates, extra electrolytes that give your body a boost going into surgery, and they help with the recovery after surgery. We do not give this drink to everybody. So some surgeons don't want it yet. Some we don't give it to diabetics just because it does have a lot of carbohydrates in it. So that one is just very specific. But if we give it to you, it is to help you and help promote a good recovery as well. Surgery can be canceled if you don't follow the instructions, okay? Checking in. So if your surgeon has told you you're staying the night, it's often easier to leave your luggage in your vehicle and then maybe have a family member bring it up to you when you get to an inpatient room. You're going to check in through the main entrance at the front desk. If for some reason you have a super early check-in or a weekend check-in or something that's a little out of the norm, you can check in through the ER and let them know you're there for surgery. But the vast majority of our patients just go through the main entrance and then check in at the admissions desk there. Volunteers are there to help assist you, will help get you to where you need to go. Pre-op area, so generally you're in this area for an hour and a half to 2 hours. During this time frame, the nurse is going to start your IV. Anesthesia is going to come chat with you. Surgeon's going to come in. They're going to make sure they're doing the right procedure on the right person. We just want to make sure things go well for you, okay? Family can be with you during this time. The area is a little bit small. Rooms are small, so we usually say just no more than 1 or 2 people with you. And then make sure that the nurse has your accurate phone number of your loved one because they can text them updates. The post-anesthesia care room or the recovery room, this is where you go right after your surgery. So during this time, the surgeon will find your family, usually in the waiting room, and tell them how your surgery went. Time in this area just really depends. Basically, we really want to make sure you're waking up okay. We want to get your pain under control. We want to make sure your vital signs are looking good. So usually family will join you after you leave this area. And you know, it just depends on the surgery, but you know, you can be anywhere from 30 minutes to an hour and a half. Just really depends, or more, just depends on how well you're doing. But the nurse should keep you updated. While you're in the hospital, there are different things nursing is going to be doing. So they're going to be watching your vital signs. They're going to be checking your bandages, you know, making sure you don't have any abnormal drainage. They're going to monitor your pain, let them know if you're nauseous. Big one is they're going to assist you in and out of bed. You've just had a big surgery, you have anesthesia on board, we have pain medications on board. We really don't want you falling, so we do encourage you to call, don't fall. So they're going to administer your medications, and then they want to support and encourage you. So they love when you are active and participate as well. Reducing post-op complications. So these complications can occur in the hospital or even after you go home and you're discharged. We try to do a lot of things to help reduce the risk of these complications, but they can still occur. And our biggest thing is we want you to know what to look for and when to be aware that, hey, maybe I need to get this checked out. The first one we'll talk about today is what we call a deep vein thrombosis, or DVT. The other name for this is blood clots. Okay. Oftentimes they occur in your legs. Signs and symptoms, so you can have increased pain, tenderness, swelling, redness. And one thing I do like to emphasize is it does not have to be the operative extremity. If you're having, say, a total knee, on the right, it can be in the left or the right. It doesn't necessarily have to be the one that you had surgery on. For this, definitely call your surgeon. Also appropriate to go to the ER and get it looked at. Sometimes little pieces of these DVTs or blood clots can break off and go to the lung. This is a big deal. We call this a pulmonary embolism. And this, you do want to seek emergent treatment. So if you're having chest pain, shortness of breath, anxiety, feeling of doom, just call 911. And I will say, I worked in the ER for several years, and I've seen people try to drive themselves to the hospital and not quite make it. If you are concerned about a PE, if you're having chest pain at all, just call 911, okay? Because they can be giving you care during that time when you might not be able to. Blood clot prevention strategies. So we really don't like blood clots. I'm sure you don't like blood clots either. So big one is moving early. Oftentimes we'll get you up even within an hour or two of your surgery and get you walking and moving. That's going to help improve circulation, decrease risk of those blood clots. If you're not able to get up, just simply, moving your feet up and down, doing what we call ankle pumps will help reduce risk of the blood clots. While you're in the hospital, you will likely have some SCDs. So they wrap around your leg and they compress them, right? It's kind of like a massage. It just helps prevent those blood clots as well. Depending on your medical history, you will go home with some blood thinners. It may be a baby aspirin, or it may be something stronger if you have a history of blood clots. We don't want you getting those. So that one, the blood thinners, is really up to your surgeon as far as what they want to do to help reduce that risk for you. Infections. So signs and symptoms are increased redness, swelling, tenderness, cloudy drainage, chills, high fever. Notify your physician immediately. Often treated with antibiotics, but it's something they do want to keep a close eye on. Sometimes these infections can get out of control and be life-threatening, but if we catch it early, if we treat it early, a lot of times we can avoid the big treatments. I mean, depending on what it is, they may have to go back into your surgical site and clean it out. So if you have a high fever, a temperature over 100.4, let your surgeon know immediately. Infection prevention. So we all got great with this with COVID. Basically, lots of hand washing. Okay. Everyone who comes into contact with you should wash their hands, and you have a right to ask people to wash their hands or at least use sanitizer if they're coming in. Okay, signs of pneumonia. So fever, coughing, shortness of breath. Some of the causes are, you might be taking some pain medications, you just had anesthesia, you're not as mobile as you were before surgery. So all of that, you're just taking a lot of more shallow breaths. So you're not getting those nice deep breaths. So great thing is moving early, getting up and moving. When you get up and move, you have to take those bigger breaths, so it helps open up those lungs, decrease risk of pneumonia. When you're in the hospital, you should receive an incentive spirometer. The nurse will show you how to use this. It just helps keep those lungs nice and open, decrease that risk of pneumonia. Dehydration. So a lot of people don't think about drinking fluids after surgery because they're just, one, not thinking about it, or two, they don't want to get up and use the bathroom all the time. Your body needs those fluids. Make sure you're getting plenty of fluids, okay? And it doesn't always have to be just water. I mean, you can get some Gatorade in there or whatever beverage you want, but just make sure you're getting lots of fluids.
Hi, I'm Jason, and I'm one of our acute care therapists here at Eastern Idaho Regional Medical Center. And I'm going to talk to you about the rehab portion here. So you have a good chance of seeing two types of therapists here, a physical therapist and an occupational therapist. People often ask me what the difference is, and well, there's a lot of overlap. However, basically physical therapists are responsible for assisting you, getting you in and out of bed. We will talk about your any special precautions you have. We work on walking, teach you how to use an assisted device. And we'll probably likely go over some exercises. Occupational therapy will likely also be in green like myself, but they tend to take these rough mobility movements that I'm going to work with, and they work on dressing and toileting and bathing at times. And that's where occupational therapy comes in. So obviously we're really concerned about safety. And as we pointed out previously, we really would like you to call us rather than getting up by yourself, especially that first time. Also take note that falls are always a scary thing when it has to do with winter or in a situation where you're rushing. As we indicated, it's really important that we get you up. We're going to likely try to get you up the very same day that you have surgery. We really encourage mobility here in the hospital. And even when you go home, especially when you go home, it'll probably be very important that you get up at least every hour or so and do the hallways or the little circuit that you might have in your home. Obviously, this is a process, and you'll start out slow, and you'll be walking short distances and working up to greater distances and more activity. So we're going to encourage you to to avoid tight clothing and wear loose clothing. And the reason for that is initially you might get up and you may not have very much swelling. However, as you set up, you may find that you have more swelling and your clothes might not fit. So of course we encourage you to wear loose fitting clothing. Shoes, non-skid shoes specifically, are very important. Please bring those to the hospital. I have anti-slip socks, but I think shoes are better. So please bring those. You're going to be resuming your activity as soon as possible. Our goal is to kind of get you into a rhythm of getting up and moving in a way that you normally would at home. In regards to total knees, it's really important to remember not to put anything behind the knee. You're going to be tempted to use the bed to bend the knees or to put a pillow behind there. It's really important that you don't do that and that you work on keeping your knees straight when you're in the bed. In regards to hips, although we're going to be giving you exercises to be doing, you don't want to overdo it with these exercises. A lot of repetitive motions with hips is not indicated. So if you're given a home exercise program that says 3 times a day, you probably should stick to that and do it maybe in the morning and in the lunchtime and in the evening. Usually 5 to 10 reps of each exercise. You want to follow whatever your surgeon says, even though we're giving you some general guidelines. You definitely want to follow what your surgeon's suggesting that you do. So if you're having a total hip, you probably won't tolerate laying on the side that you've had the surgery. There are some ways to mitigate this. I suggest that if you do have an easy chair, that might be another way to get comfortable. In regards to the spine, so you don't want to do any bending, lifting, or twisting, and that's really easier said than done. It's very tempting to reach forward and put on your shoes or to twist to move something from one place to the other, but you really want to avoid that. The best therapy for a spine surgery really is going to be walking. Although you do have some exercises in your booklet, and I do encourage you to do those. You will have a booklet that you're going to get as a course of having surgery here, and I would encourage you to do these both before and after surgery. So in regards to performing stairs, so if you're going to do stairs, you want to step up with your stronger leg. Or your good leg in the case of a total joint surgery. So it would be your non-surgical leg. When you step down, you're going to step down with your surgical leg. And the reason you do that is because you want to lower yourself with your stronger leg. In regards to spinal surgery, it's not uncommon for somebody to be a little bit weaker on one leg than the other. And again, I encourage you to go upstairs, step up and do one step at a time with your strong leg and step down with your weaker leg. Also, to keep in mind, if you're on your stairs and you do feel dizzy, nobody says that you have to do them all at the same time. You could always have a seat on the staircase if you were to get dizzy or lightheaded. Safety first. If we're going to discharge you, usually what we do is we look at the things that you will need to be able to do at home. Obviously, if you live alone and you're not going to have anybody with you, that bar is going to be set really high. So, the sort of questions that we will ask is, can you get up and down out of the bed and maintain your precautions? Can you stand? Can you walk 150 feet? Are you able to do stairs? Can you get to the bathroom? These are all questions that will be important in regards to whether or not we feel like you're appropriate for discharge home versus coming up with a different plan. So again, back to safety, this is going to be a process of you getting better, and you're really not going to be well healed till you're 6 to 8 weeks out. So but before that time happens, you want to be really careful when you're walking on uneven terrain. In the wintertime, that would be watching out for, walking on snow where the snow might give away or ice might give away and you might fall through. In the summer, it could be grass that has been cut and maybe there's some non-visible holes that you might step in. You have to be very careful with that. Of course, we want to get you back to your normal activities. If you're a person that's really active and does golfing and sports, that's great, that's fine, but you do need to be well healed 6 to 8 weeks and have permission from your doctor to enlist and do those activities. Climbing on ladders. We are all tempted to get on ladders. However, especially in the earlier goings with your surgery until you're well healed, I would urge you to resist getting on ladders. It's just so easy to step off in an awkward way and injure yourself. Aquatic exercise. Now, I highly encourage people to go to the pool, and that's a great idea to unweight your body, and it's low stress. However, if you're going to go and do the pool, you need to make sure that your incision is fully healed. And lastly, sudden jerking motions. So this kind of goes in with the whole fall risk thing. You want to avoid situations where you might slip or perhaps get in a car accident or something like that where there could be sudden motions.
Okay, for pain management, important topic to discuss. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So pain is necessary. It tells us when to take our hand off a hot stove, right? But with surgery, we know why you're in pain. So how do we control that? Oftentimes, the reason why you're in elevated pain, you had a big surgery, but you also have inflammation. Anytime we do surgery, we cause some sort of inflammation, and that can increase the pain. It is important to know we do not expect you to get to 0 out of 10 pain. We do expect you to have some pain. However, that pain should be well managed. It should be controlled. And so our goal isn't necessarily no pain, but more of what we call a functional pain. It is a pain that you can get up, you can work with physical therapy and get more from those sessions. Attempting to get pain-free is not safe. A lot of times these pain medications can reduce cognition, they can reduce your respiratory rate, they can drop your blood pressure a little bit. So there is a fine balance between getting well-controlled pain and not necessarily pain-free. We'd rather have you in a little bit of pain and alive than risk your health and have you pain-free. But just have honest communication with your nurse. I know a lot of people struggle with the 0 to 10 scale. We know that it is different for every single person. We know every person is going to not have the exact same number when they come out of a total joint or a spinal fusion. Our biggest thing with using the 0 to 10 scale is, if you said your pain's an 8 out of 10 and we give you pain medication, has that pain medication helped? Are you still at the 8 or did you come down to a 7 or a 6? It just helps us assess if what we're doing is helping and if it's working or if maybe potentially we need to call the surgeon and, figure out a different strategy. But we really just are trying to assess, okay, where are you? What is realistic for you? Pain medication should only be used for pain. So if it's not to be used when you can't sleep, you have anxiety, depression, we have other medications for that. If you're using narcotic pain medication to help with all this other stuff, it just increases your risk of dependence. And we don't want that. We don't want you to have dependence on it. As I said, we want you to have a high quality of life, a good recovery afterwards. In each room, there are things to help with that communication. So whiteboards, the nurse can write down, okay, I had my pain medication at 2:00. Your next dose is available at this time. There's clocks in every room to help with that. So, just communicate well with your nurse is what I strongly encourage. Pain management strategies. So medications are directed by your surgeon. Your surgeon is the one that's going to order the pain medications. The nurse will then give it. Okay. There are different types of medications that we can use. We have narcotic pain medication, which may be hydrocodone, oxycodone, something around those lines. We have anti-inflammatories, non-steroidal anti-inflammatories. That might be, like your meloxicam or naproxen or ibuprofen or Celebrex. So lots of different medications in that group. We might use Tylenol. There might also be some muscle relaxers, Robaxin or cyclobenzaprine. There's also, medications that help with nerve pain, gabapentin or Lyrica. So it might be that we use a combination of these medications to give you relief so that you're not having to do high doses of narcotics. You will have scheduled versus as needed medications. So scheduled medication might be blood pressure medication. If you're taking that every day at 9 a.m., we will bring that to you. If usually pain medication is what we call as needed. So if you're starting to feel that pain level creep up a little bit, just let your nurse know so that they're aware and they can get you medicated. IV versus oral medication. So IV pain medication is great. It works really quick. However, it doesn't last very long. And so we try to get you on oral pain medication fairly quickly because it lasts a lot longer. You can go home with oral pain medication. We don't generally try to send you home if you're still needing IV pain medication. We want to make sure your pain is controlled with just taking a pill. Depending on the surgery, you might be able to get a spinal or an epidural during that surgery, and nerve blocks for some surgeries. So for example, if you have a total knee, a lot of times we can do a nerve block and numb that knee area. It's kind of like when you go to the dentist and they numb just a little portion of your mouth that they're going to be working on. We can do that for certain surgeries, but the knee, it seems to be really effective for. Weaning from pain medication. So this will be directed by your surgeon, okay? Once you leave the hospital, continue the same regimen for 1 to 2 days. I usually say, the first up to the 3 days are kind of the hardest because you have all that extra inflammation. After 1 to 2 days, begin to start weaning yourself off your medication and start with the stronger medication first. So if you're on a narcotic and a muscle relaxer, I would maybe try to reduce the narcotic first. Most patients have weaned off pain medications by 2 to 3 weeks, or at least gone back down to where they were prior to surgery. Some people have chronic pain and have been on pain medications long term, but generally by 2 to 3 weeks, you should be off the pain medication from the surgery. Don't take your pain medication routinely at the maximum amount allowed. So let me explain this. So if you go home with a prescription that says you can have 1 to 2 pills every 4 to 6 hours. If you take 2 pills every 4 hours consistently, you're going to run out pretty quickly. So if you need to do that initially, that's okay. But to do it until the bottle is gone, not necessarily should be done. So, maybe try one pain medication, and in 2 hours, if you're still hurt, and even an hour later, if you're still hurting and need the second one, then you can do that. Or when you're weaning off of them, you can say, okay, instead of 4 hours, I'm going to try and see if I can go 6 hours without taking more medication. So, we just don't want you to run that risk of getting dependent on these narcotic medications. Now, I always tell people there is a time and a place for narcotic pain medication. Surgery is a time and a place for narcotic pain medication. We just want you to be aware and realize that, there is a time and a place for it, and you shouldn't be on these the rest of your life. Alternative pain management strategies. So lots of things you can do in conjunction with pain medication, or I've had a few people use these instead of pain medication. Ice is great, it helps with inflammation. Music just kind of helps relax you. Movies, they're going to distract you, same as reading or family visits. All that's going to distract you, so you're not just sitting there thinking about the pain. Position changes, get into a comfortable position, and deep breathing and relaxation. So great alternatives to assist with that pain. Huge medication side effect is constipation. So you will likely go home with a narcotic. Be proactive with preventing constipation. You've had a big surgery, you don't need to deal with that on top of it. So, stool softeners, high fiber diet, lots of fluids, and once again, getting up, moving, walking, all that is going to help prevent the constipation. Oftentimes, medications can cause some nausea. Take your medications with food, okay? Other things that can help are, if you've tried food and alternative things and you're still nauseous, let your surgeon know. There's medications we can give to help with the nausea. But, non-medication options are, you're going to be like ginger ale or applesauce, bananas, mints. My kids love mints. So, and then, as I said, always take your pain medication with some food. That generally tends to help quite a bit. Falls. No one likes falls, okay? So causes, dizziness. Maybe you're on new medication that's causing you to be a little bit dizzy. Maybe you're a little weak because of the surgery that you had, whether that's a fusion or total joint. When you're in the hospital, you have a lot of extra things attached to you. You have an IV, right? You might have those SCBs that we talked about that are helping reduce that risk of blood clots. So it might take you a little bit longer to get to the bathroom. Don't wait until it's urgent to go to the restroom. Start working on it earlier, sooner than later, okay? Call, don't fall. As I said, we don't want you to fall. We don't want you to ruin that that surgery that you just had. So just call for any reason. And then one thing I always like to tell people is anyone can say stop at any time for any reason, especially you. So if you're up with physical therapy and you start feeling dizzy, even though you're in the middle of the hallway, let them know. Sometimes they might not be able to tell. We need you to communicate with us. If you're in the hallway and you start to feel dizzy, we'd rather grab a chair and have you sit down than have you push through and end up falling and then causing damage to that surgery.
Hello, my name is Michelle. I'm a registered nurse case manager here at EIRMC. Someone from my department will meet with you usually the day after your surgery so that we can discuss care coordination and discharge planning. We talk to you about your level of independence prior to coming in, medical equipment you might already have, home health services, things of that nature, so we can set those services up for you once it's time to leave. Based on your progress during your hospital stay, it will help determine if you're able to go home or if you might need additional services. If you do need a short-term stay at a skilled nursing facility, then we will make arrangements for continued care. You must have a medical need for these additional services, and depending on your insurance, it may also require a prior authorization. We can assist with insurance questions as needed. As far as obtaining equipment goes, depending on what your surgeon and the physical therapist recommends, we will help get those things set up, whether it be walkers, wheelchairs, things of that nature. One thing to keep in mind is insurance does not typically cover the cost of equipment that is used in the bathroom. So a toilet riser, a shower chair, things like that should really be purchased prior to your hospitalization. It's often cheaper to obtain that medical equipment through a friend, Life Inc., going to Amazon. There are lots of different options available. Please give us a call if you have any questions and we can help direct you from there. Our goal is to facilitate a smooth transition from the hospital. So if you have any questions about the discharge process while you are here, please ask to speak with your case manager or social worker, and we'll be happy to help.
Okay, so discharge is really by goals, not calendar days. We know that everyone's a little bit different. Some people may need a little bit more time. Some people are ready to go home same day. We've started seeing a lot of total joints, especially lower total joints, go home same day, and they've been doing well. So, but if you have a spinal fusion, you may need a couple days. So we just want to make sure when you go home, you're going to be ready and you're going to have a good recovery. In order to go home, we want to make sure that you can urinate. We don't want you to go home and not be able to use the restroom and then end up back in the ER. It doesn't benefit anybody to do that. We want to make sure your pain is controlled. We want to make sure that physical therapy feels comfortable sending you home. You know, when you get home, are you going to be able to get to the restroom and back? If you have stairs going into your house, can you get up those stairs and into your house? Those are all big things. We want you to be able to be cleared by the medical team. So we don't want to send you home if your blood pressure is 200 over 150, right? So we want to make sure that you're going to do well when you go home. We will talk to you about your discharge instructions, any medications that you may be on, and then also we'll review how to prevent complications. Discharge day, so your medical team will keep you involved and updated on pending time of discharge. If you have any questions about that, just talk with your nurse, see, okay, what am I waiting on? And then they're happy to talk to you about that. Transportation, so you will not be able to drive yourself home from the hospital. You do need someone to take you home. Have a backup plan. Weird things happen. So just have, your main person and then maybe a backup if needed. If you're going to another facility, not many people do. Occasionally, someone may need some rehab. That facility usually will come and pick you up. After discharge, just follow up with your surgeon as directed. They will be in your discharge instructions. Wound care, follow the surgeon-specific instructions provided to you. Don't pick or rub at the incision. It is tempting for a lot of people. Don't do it. We don't want it to get infected. We want it to heal well. So just let your body do its job with the healing. Showering will also we'll talk to you about that after surgery. Nursing will discuss it and give you instructions to take home. Travel, ideally, we want you to wait 6 weeks. Okay, that being said, we have patients that travel a long ways to come and get surgery, right? We have them coming from Salmon and from Wyoming and all sorts of places. So we get that you can't always wait the 6 weeks, but ideally, if you can, please wait the 6 weeks. If you're flying, get up, move around every hour during that flight. We don't want you getting blood clots. Utilize the early boarding to decrease the need for rushing things, right? Just take your time. It's okay. When flying, when you're going through security and the medical detectors, let them know that you have a total joint or you have hardware in your spine, okay? If you're driving long distances, stop, get out, walk around every hour, okay? Stop at a rest stop. Make sure you take your assistive device, even if it's just walk around the car, if it's going up and using the restroom, just stop and move. It's going to be better in the long run to decrease that risk of blood clots, okay? If you do have any questions, please feel free to give us a call. This number is directly to our pre-admission testing department, where you would come for your pre-op appointments. As I said, there's nurses in that department, there's nurse practitioners. We're happy to chat with you. You can also call your doctor's office and ask them questions as well, okay? And even if you call us once and 2 days later you're like, oh, I forgot to ask this, please feel free to give us a call. We're always happy to chat with you.